Hello, I'm Theo. I am a PA and I will be treating you today. Here we should have a Cynan Humphreys, 25 years old, from 13 Park Lane. Okay, perfect. From what I can see from your records, Cynan, you haven't been in since 2006, which is when you had your appendix removed. Okay then, Cynan, how can I help you today? Okay, so you've slipped onto your buttocks while you were out running, and you slipped off the curb and fell onto the square angle. And when did this happen, Cynan? So a week ago, and you feel like the pain hasn't improved, okay. So can you start telling me where the pain is, please? Okay, so your lower back. And from where you're indicating there, it seems to be the thoracic region. And how bad is the pain on a scale of 1 to 10? 1 being not bad at all, and 10 being the worst pain possible. So around an 8, yes, that is quite high, isn't it? So is the pain in the back and nowhere else, Cynan? There's no shooting pain in the legs, no pain in your arms, hands or feet? Okay. And have you noticed any sudden issues while being unable to control going to the toilet at all? Have you become incontinent? No? Okay, that's great. Okay then, Cynan, are there any factors that can alter this pain rating, which might be increasing or decreasing it? Okay, so coughing, wheezing, sneezing, and any changes in sleeping position can all increase the pain. Okay, so staying still and no sudden movements can improve the symptoms. Okay then, Cynan, just a little warning now, and I know this is a very painful and delicate area, but I will have to just have a quick feel of the area, just for me to get an idea of the location, or if there's any bumps or deformities in the spine, okay? I do apologise. So Cynan, on first inspection, there are no visible protrusions from your back, which is good, as this decreases the likelihood of a burst fracture, where the whole of the vertebral body fractures. And the vertebral body is the most anterior or forward part of a vertebral bone. And these types of fractures can be very severe due to the location of your spinal cord, which lies directly behind this portion of the vertebrae. And I also cannot feel any prominent kyphosis or sharp angulation of the vertebrae in an anterior direction, which means I couldn't feel any sharp sudden bending of the spine forwards, which would be pointing towards your heart. Next then, I will have to give you a neurological exam, Cynan, which will give us an indication as to whether your spinal cord has been damaged or at risk of being damaged. So the vertebrae that I mentioned earlier might have fractured and is pressing on your spinal cord. And I will check your reflexes and muscle strength in order to determine this. From these tests, everything seems normal, which would indicate that your spinal cord is not damaged and that your vertebrae are not pressing against your spinal cord. And now, Cynan, I will go and order you an X-ray. Although I mentioned I cannot feel any abnormalities when I gave you a physical examination, fractures such as compression fractures can go undetected. So it is better to be safe than sorry. So as soon as we get those X-ray results back, I will discuss them with you. Okay. From what I can see here, Cynan, there is a wedging here of your 12th thoracic vertebrae, or if you're counting down from the head, this will be the 19th vertebrae down. The thoracic portion of the name just refers to the region of the spine where this fracture here is found. And from what I can see here, this is a minor stable fracture, as the height of the anterior section, which is this front portion here, of the vertebral body is more than half that of the posterior or the back side of the vertebral body, which is here. And I believe this has occurred as your slip onto your buttocks and sudden movement of your head forward as you landed has caused the force of the fall to direct upwards and through the anterior portion of your thoracic vertebrae. In the middle of the bone is a cancellous portion, which looks a bit like honeycomb. And this portion has collapsed in the fracture. And if you want to think of it in simple terms, just think of standing on top of a Cadbury Crunchy chocolate bar, and that has the same sort of effect that we see here in your x-ray. So then, this first image here is a CGI representation of a compression fracture, and I thought this would give you a clearer idea of the general nature of a vertebral compression fracture. And here you can see that this stable compression fracture is just like yours, and it shows where the anterior portion of the vertebral body has fractured. This second image is a representation of a burst fracture, which I mentioned earlier, and I just wanted to show you this just so you can get an idea of how vital it is to be able to differentiate these two fractures, as a burst fracture can be very, very severe. Okay then, Cynan, I will now discuss some treatment options with you. And due to the findings that your fracture is stable and that we got your neurological examination and everything seemed normal there, then the treatment we will choose will also be very straightforward, and this is known as a conservative therapy. And this is a non-invasive option, and it will aim to get you back to normal function and pain-free within about 3 months. However, for the time being, I understand that you are in a great deal of pain. So we can offer you some analgesics or painkillers in the form of non-steroidal anti-inflammatories, such as ibuprofen, or opioids, such as cocodamol. And it is important for you to try and keep as active as possible, please, Cynan. So this could be some light swimming or some short walks. But the main point is to try to avoid bed rest, as this can worsen symptoms such as giving you joint soreness or joint stiffness. And if you do need some increased support, we can offer you a back brace should you require it. And if you feel like you're still not improving, Cynan, and the pain is still unbearable, surgery might be an option, but this is really unlikely in your case. An example of such a procedure is a kyphoplasty, where a needle will be inserted into your damaged vertebrae and a balloon will be inserted and inflated. The balloon then creates a cavity where bone cement is inserted to provide support. But like I said, this is really unlikely in your case. So Cynan, do you have any questions? No? Well, if you find out that your pain is not improving, or if you have any other general queries, then please come back and see us. Okay? Thank you very much, Cynan.